Hi guys, Dr. Renato here with the Chiropractic in Eden Prairie. Today I'm going to talk to you about what causes back pain. Believe it or not, statistics show us that about 75% of people are experiencing some kind of a back pain, so it's extremely common. There's two different types that I want to cover today. The first one would be acute back pain, and that's more of like 3 months or less. So if you've been dealing with back pain and it's been less than 3 months, then we would consider that more of an acute back pain. Today, really what I want to do is I want to speak to the folks that are dealing with more of the chronic back pain, which is anywhere, so over 3 months, or some people say even more than 6 months. So let's go over some of the basic structures in your spine today, so you can kind of get a better idea of what I'm talking about. So here's my friend's spine. I'm going to just explain some of the structures in the low back that could be contributing to your back pain. So these bumps here, these bones here, those are the bumps that you feel on your back. Those are called the spinous processes. Okay, and then here's your sacrum. So this is your sacrum, also known as the tailbone. This right here is the sacroiliac joint, or the SI joint. And then these are your vertebrae. So here we have L5 that connects to the sacrum, L4, 3, 2, 1, and so on and so forth. So some of the most common areas that cause back pain, number one, more of that acute back pain would be a muscle strain. So if you look at your low back, the most superficial layer that you feel in your back are the muscles, and that's more of the acute, less than 3 months sprain, strain to the muscle. Usually resolves itself. What I'm talking about, the chronic pain, the pain that you've had more than 3 months or more than 6 months, is going to come from some of these structures here, more biomechanically. So the first thing I want to point out to you is that I'm sure you see this orange gummy bear sticking out. Well, this is supposed to represent a bulging disc. Okay, so if that is that's one of the ways that we can have back pain, and that's when this disc bulges out and then it puts pressure on this yellow structure here. And I'm sure you see all these yellow structures. Those are the nerves that actually are coming out of your spine. That's one way that we can have back pain, and that's where you would experience more of a sharp shooting pain that will go down into your legs, into your lower extremities. Another version of that would be a disc herniation, where actually the substance inside this jelly-like thing that actually comes out. That's even a bigger problem, but very same presentation. You'd have the pain that's sharp shooting, again going down into your lower extremities. Another way that you can have back pain is actually irritation in these joints here. So that can happen several different ways, through arthritis, through irritation, through biomechanics, so poor posture, injuries, sports, slip and falls. So what happens is that these bones, they move out of alignment, and then this joint here can't move properly, can't function like it should. That's one way. And then a really common way that we treat here in the office, and I'm going to speak about that in just a little bit here, is the SI joint. So that's common back pain source as well. So and these would be your hip bones. This is where your legs would attach and come out here on the side. So those are just some of the structures that are responsible and can cause back pain. Next time we're going to go over some things that you can do to help yourself, or some things that we as chiropractors can do for you to help yourself, to help you with the back pain. So stay tuned for our next live. We're going to do a Wednesday night live here at 12. Thank you so much for watching.